Hi everyone, if you have knee pain, we wanted to inform you of 5 very key things that you should be looking at for recovery of your knee, especially chronic or osteoarthritic knees. Number 1 is lubrication. Some of you have heard of viscosupplementation, hyaluronic acid. It's got trade names like Genvisc and Synvisc,
Supards.
There's many different companies that do it, but that lubrication is something that can help the knee to move better. Insurances cover most of it. That's number 1. Number 2 is to increase your healing ability. And one of the best things out there is PRP, which stands for platelet-rich plasma. And in that, we actually take your blood, we spin it, and there's a thin layer that's got the healing ingredients in that, in your blood, to help you to heal better. It's just very, very concentrated and supersized for you to heal better. We are combining PRP with the viscosupplementation to have really great results. So those are 2
I'm going to
things.
even tell you about a study that we came across that propelled us this direction. They did a study on people that had the Synvisc or this viscosupplementation alone, compared to PRP alone, and then they did the 2 together. And the worst was the visco alone, then it was PRP alone, but the very best was when you combine the 2 together. They have different actions and they seem to work well together per the study. So we're excited about that.
Yeah, so if you're going to a provider and all they're doing is that visco supplement, they're a little behind the time, and it's time to, to increase that ability. Also, to help with healing, we use lasers. And so that 1-2 punch has been great, but that's only 2 out of the 5. So.
You know, it's interesting. I've had many patients tell me the viscosupplementation helped for a while, and then it stopped helping. And we feel adding that PRP was the missing ingredient. So we're excited about the combination. Yes, there's other aspects of knee recovery that we've had really great success with. Let's not forget about the tried and true physical therapy, right. And chiropractic care. We are, as a chiropractor, I'm a chiropractor, we're looking at the alignment of the knee, alignment of the feet, alignment of the hip and back. All of that plays a role in the mechanics. The physical therapists are doing the same, but they're also addressing the imbalance of muscles that could be creating knee pain. Missing that, even with a healthy like chemistry, could create ongoing knee pain. But chemistry is another issue, so now we're on to a 4th aspect that needs to be looked at. We want to look at your chemistry and see if you have inflammation markers. Are there arthritises that we could find on the labs? That gets missed, and sometimes we have to change diet because you've got a pro-inflammatory diet, and not only the knees hurt, but the back hurts, the elbow hurts, the shoulder hurts, and everything hurts. And so we have to look at chemistry as well. And if you miss that, you might be giving the patient very good care, but if they are feeding themselves with a pro-inflammatory diet, we got a problem. Really the last thing, and it's maybe new for many of you, and that's the idea of acupuncture. It's going outside the traditional Western medicine approach for knee pain, and it's taking a completely different, again, approach that's based on meridians and healing based on the flow of energy in the body. And if there's a breakdown in that flow of energy called chi, then it will lead to eventually some kind of a breakdown in a corresponding body part. In this case, we'd be looking at the knee. So the great thing is we're combining these. We're looking and evaluating on all of them.
Yep.
And so that requires several different providers. Nobody can do all of things well, so we take a team approach for that.
Right. So 5 things. Get the healing better with PRP, viscosupplementation, fix the biomechanics, reduce naturally whenever possible the inflammation, and increase circulation with acupuncture.